Sister, put RT. RT. So good morning guys. We have already seen, you can see this video. So this video shows up, you can see this visible peristalsis movement of intestine. So she is we'll discuss some case. So she is a 65-year female patient. She came complaining of absolute constipation since 4 days. She had not passed stool and not passed any gases and continuously nausea and vomiting. So with this complaint she came to hospital. So during during examination inspection only clearly abdominal shows that fully distension abdomen was there. Along with you can see this is a like visible peristalsis movement were there. So what is meant by visible peristalsis movement? So this is also called as step ladder movements of the intestine, that is seen by inspection. So if it is there means it is directly diagnosed goes towards the intestinal obstruction. It may be a small bowel intestinal obstruction, it may be large bowel intestinal obstruction. So in this condition she is having full visibly peristalsis movement. You can clearly visible. So this is one of the rarest presentation. In every patient, most of the patient of intestinal obstruction, they came with complaining of all the cardinal symptom of obstruction. So what are the cardinal features of obstruction? They will come with complaining of history of absolute constipation. What is meant by absolute constipation? Absolute constipation means not even a stool with gas. They will not pass even a flatus and feces. So they will not pass both. So this condition is called as absolute constipation. So this patient usually, in generally young patient, old patient, they will come with complaining of absolute constipation, abdominal distension, and continuously vomiting. All these three features with abdominal pain is there means we suspect directly towards the intestinal obstruction. So in this patient we see that directly visible peristaltic movement were there. So it indicates that there may be a one-sided large bowel obstruction may be there. Whatever the obstruction, just distant to that part will be getting mobility. You can see that intestinal mobility clearly. So in this condition, so this is a case of intestinal obstruction. So how to proceed and how to approach, what investigation to be advised in this case, and what the treatment. So first we know the definition of obstruction and everything. So investigation advice to be only one thing is, first investigation is standing abdominal X-ray. So we have to take standing abdominal X-ray to see the dilated bowel loops, whether it may be a small bowel obstruction, whether it may be a large bowel obstruction, both will clearly seen in the standing abdominal X-ray. If you have any doubt and any query, then you have to advise the CT abdominal plane with contrast. One more thing is what you have to do is treatment is ultimately it's a surgical option only. So what are the just pre-operative measurements? We have to keep patient NBM and we have to put some RT to aspirate the things. And one more thing is we have to put an antibiotic that covers the 4 gram-negative and gram-positive organism. And one more antibiotics to be added is you have to add a metronidazole. It will cover anaerobic infection also. And you have to give full dehydration. Patient may went in dehydration. We have to give fluid. So this is the pre-operative measurements. One more thing is we have to see whether this patient is having these symptoms or distension since only 1 day, 2 days, or since morning and everything. If it is crossing more than 24 hours, more than 8 hours, 12 hours, it may lose that intestinal, some part may be like there will be less blood supply to the part and they will maybe get gangrene and that part may be cut. So some patient they will end up with the colostomy, some patient will directly goes towards the end-to-end anastomosis of intestine, they will pass normally. So depending on the condition, like whether when the patient will present to hospital, so this is the only thing. So what you have to do is we have to only key point is we can see the visible peristaltic movement of intestine. This is the rarest presentation. If it is there, means directly we have to go for the chest X-ray, standing abdomen X-ray, and we have to go according to the surgeon opinion. Thank you. And one more thing is we'll just see some. We have to standing abdomen X-ray. We'll see the X-ray now. So you can see this. This is a standing abdominal X-ray. So you can see this. Both lungs were clear now. There is both angles were clear. There is no any pleural effusion, no any cardiomegaly. We can see this whole dilated bowel loops. You can see this one, and this one. These are the dilated bowel loops. It mostly likely to be a large bowel loops. So you can see the centimeters from here to here. You can see centimeter 1 to 8 is there. From here to here almost 8 centimeters is there. Now also it is almost 6 centimeter. So anything, if it is large bowel obstruction, means it should be a more than 3 to 4 centimeters. There means it is a large bowel obstruction. You can see here and here dilated bowel loops were there. So if it is there, means directly it is a case of intestinal obstruction.